Like, there we are. We're in, Sarah. We're in.
Hey,
So as you guys know, anyone that's new to our 3M community, I try to do expert interviews every quarter. So somebody that's an expert in their field, we bring them on, we ask the questions like you guys saw in our group. And today I'm so excited about this conversation because, and you'll agree, right, Sarah, too? Like, it really, even though menopause has been brought to light a little bit more, it's kind of like this hidden thing. Like, no one really wants to talk about it. And that's what we're going to be doing today. So I really applaud you guys for forwarding some questions that you've had. And then we've had some questions that I get from sort of being out and about and doing my speaking engagements, etc. So we're welcoming Sarah Dixon. I always say Dickinson.
I know I get that a lot. It's okay.
You get it a lot? Okay, perfect.
You're not the only one.
She's a fellow Canadian, a fellow Canuck, and she's joining us. She's a registered holistic nutritionist as well. She's a health and nutrition counselor. She's a menopause health coach, which I love. And she's the creator of the Menopause Balance Method. So she has menopause brain. So she is going to shed some light for us. And we're just, again, like we do, just have a quick casual dialogue on the lovely topic of menopause. So tell us, and because we're new, we don't know each other, tell a little bit more about your journey. I know, this is so fun. How did it come from experience? Like,
oh yeah. And thank you so much for inviting me to do this. I'm so passionate about it. This is really everything that I think and eat, dream, breathe. It's menopause for me because I have had a really tough journey through menopause. And so we were just talking about this earlier. I am in the pharmaceutical industry and I've been in the industry for 20 years and I do a diabetes portfolio.
Easy. Yeah.
So, you would think as a pharmaceutical rep, I drink the Kool-Aid. It's always medication. Medication's the only answer. And I've always dabbled in holistic alternatives. It's just been my passion. I feel like, if your body is telling you something, then you need to listen. And I didn't always believe that medication was the only route that we always have to take. And so along comes my perimenopause experience at 42. And it manifested in me, in my gut, and in my mood. So I was a bloated bitch. That was pretty much
I love that.
Where I was constantly uncomfortable and I was constantly pissed off. And so I just thought, this is really weird, and then people around me start commenting like, gosh, you're really sensitive and it's not like you. And I start going places because I couldn't fit into anything. And I thought, this is really not normal. And so my first place, of course, is I need to go to the doctor. I need to describe my symptoms. I need to share with what's going on. Now, my GP was quite good. Through the investigations, I ended up going to a gynecologist and a gastroenterologist. And through that journey, which took a few months and lots of tests, which is great. It's a peace of mind, but everything was clear.
Everything came back normal.
Yeah, as we know, right? We hear that a lot. I had my thyroid tested. And when I was at the gynecologist, she even did the sort of the classic menopause test.
Yep.
And for me, she came back and she said, yeah, you have started perimenopause. And so I thought, okay, now what? And she said, well, based on your history, HRT is not an option for you, because this was 15 years ago. I'll be 58 in February. So this was like, give or take 16 years ago. And this was still around the fear around HRT. And
we're going to talk about this in a bit.
Yes, we are.
Yep.
Such good stuff. And so my mother had breast cancer at 37. And then breast cancer again at 70. And so that put me in a high risk category. And I actually subsequently do, for those of you who are in Ontario, you've heard of the breast screening program in Ontario, Canada. And that is what I'm in. I did the testing and I'm now in an accelerated care for my breast care every year. But things have changed. We've moved out of that. And so HRT wasn't an option. So she's like, yeah, that's not an option. Really isn't going to help you. Bye-bye.
See ya.
You're left, right? You don't know you don't know what to do, you don't, and then the hot flashes come.
Right. Or they tell you it's normal. Sorry, this is your rite of passage. This is what it's supposed to be. And I think many, raise your hand, guys, and I'm going to look in the chat here too. Like, if you're just like, oh, because your friends are going through it. Oh, you haven't got hot flashes yet. Oh, I got my hot flashes. Oh, it's totally normal.
And that's
Right.
that's I think part of that whole mystic menopause syndrome that we're in,
Yeah.
that you hear from your girlfriends, either they're not experiencing symptoms. Now keep in mind there are 37 symptoms in the spectrum of menopause.
Ooh.
We're not just
Okay.
talking about hot flashes, you're a little moody and a little bloated. Like there are 30.
Oh, you're frozen. There we go. You're back.
I just had an email pop in. I wonder if that
Yeah.
did it.
Yeah.
So that these are valid concerns, and these symptoms can be extremely disruptive. I mean, 60 to 80% of women are going to experience hot flashes and night sweats. And this is a
Okay.
journey that can take upwards of, especially in the peak of your symptoms, you can be looking at 8 to 10 years of suffering. And so
Wow.
we
Because
don't
don't they
need to get.
classify menopause like when you haven't had your period for a year? Samantha Gladish and I talked about it because she talked about perimenopause. So
Yeah.
menopause is like you're officially menopause if you haven't been tested. If you haven't had your period for a year, it's like that magic year for whoever came up with that. And then once that is, then are you officially now post-menopause or are you in the
Exactly. Yeah. So perimenopause is, I mean, we go through premenopause, right? Always up to
Yep.
transitioning into perimenopause. And there's no sort of magic announcement that, ladies, you're in
No.
perimenopause. You just start feeling different. And it can be as early as into your late 30s. It can be early or even into your early 40s. And we're not
Yeah.
even talking about women who have had their ovaries removed in a hysterectomy. Or,
Right.
so there
Oh
are
yeah, we talk about that in the three. It could be liver overload, it could be high stress. Like there's so many things that can trigger you into that perimenopause realm and the symptoms that come into perimenopause,
Yeah,
right?
so your perimenopause is
Yeah.
usually 8 to 10 years. And I was
Yeah.
right on like I started at 42 and I became postmenopausal at 52. And that's to exactly like you said, when you go one whole year without
Yep.
your period, that is menopause. That one day is what they call menopause. And then after that is postmenopause. So you've kind of got three terms: peri, menopause, and post.
And menopause is just a day. And this is
Yeah.
I love that we're having this conversation. And I'm just going to segue to, and I'm going to introduce you, Sarah, to my girlfriend, Jacqueline Court, started a forum called She 2.0. She has a podcast. She has an online forum. She's a fabulous writer. She does in-person events in Toronto all around bringing awareness to menopause. And every time I go to her events, I get a nugget just like this nugget too. And I remember hearing that. And listen, I've been in the health and wellness field and have certifications out my yin yang. That menopause is literally that one day. It's like when your year anniversary happens, okay, menopause, next day, now you're officially in post-menopause. So you transition because you started educating yourself because you're like, okay, HRT isn't an option. So I'm going to start now looking into more holistic ways. And obviously the symptoms that you felt, and there's over 30 symptoms, which
Yeah.
I also didn't know. Like you
Yeah.
always think the hot
37.
flashes, the night sweats, the moodiness, right? The bloating for sure.
Yeah, there's hair loss, there's joint pain, there's inflammation. There's
Yeah.
so many different things that are typical for women, even through going through our menstrual cycles. Those are typical symptoms.
Right.
But we just get used to it and it becomes normal because this is just what we put up with. And we're not
Right.
having conversations about, why are you feeling like this? You should not be feeling this way. And as we age, we want to feel the best that we can feel. And
Right.
so we're not having conversations about what's going on with our body and how we can manage that. We're
Right.
not going to be the best that we can be.
Right. So rather than saying to ourselves, oh my gosh, the hot flashes, I'm postmenopausal now. This is just a rite of passage. And this is what I tell our 3Mers all the time. Don't judge, get curious. Right. So rather than just sitting with it and being like, I might need HRT, maybe it's my estrogen, I don't know, I'll get some testing, get curious and start looking at what's going on around you that can help.
Absolutely.
Right.
And there's there's so many, there's so much information out there, and it's very overwhelming, and it's very contradictory. And so people say, you know, go to your doctor and get a menopause test. Well, there is no official really menopause test. I just happen to be, if you want to put it this way, lucky, because my hormone levels must have been very volatile when she did the blood test.
Yeah. Oh, another email came through.
Did I say? So am I good? I'm back. So another woman behind me could go in and have the exact same test, and the doctor says, no, you're fine. So this is why we really need to, like you say, no judgment, but curiosity, ask questions, because it's you and your body now. You have to be an advocate for something is not feeling right. And even if you don't get the official, you're in perimenopause, you just know if you're in that age range now and things are changing, that you can start to ask questions. And I always say to my clients, let's get our baseline, go and see your doctor, get a full physical, get your thyroid tested. I was
going to say where to start. Okay, so where do we start? We're feeling it. We want to go to our doctor. So, okay, perfect. I totally interrupted you.
No, it's all good. Yeah. So that's where you really want to start. The first place you want to go is to your GP. And you need to, before you go, you need to just be prepared. What are you open to? What, you know, if you are in that perimenopausal age now, are you open to HRT? Are you open to antidepressants? Or are you wanting to take a natural route first? And the indicator for that is, how severe are these symptoms? How are they disrupting your life? Are they severe? Are they moderate? Or are they mild? Are you just starting to notice the change and you want to get on it right away? Or have you been suffering for a while? And that's going to dictate the conversation you have with your GP as to whether or not you really need that support, or you're saying, okay, I'm starting to feel different. Things are changing, but I want to kind of just make sure my thyroid is okay. Make sure I'm not hypo or hyperthyroidism. You want to make sure that you have a full physical. Make sure your iron is in good shape. Make sure you take a look at your life. Where's your stress levels? How are you sleeping? What's your nutrition? And those are the things that you want to start to take a minute for yourself. Women do not give themselves enough time, but take a minute, give yourself the honor of listening to your body and saying, okay, let me just do a quick check. How is my stress out of 10? How am I eating? How am I sleeping? And then go to the doctor with all of this. Now, when you get to the GP, you may or may not get the response that you want.
This is a huge one. This is what's one of our questions, right? Like, because they have the pressure too of being what they know. And it's like, here you go. Right? Or everything's normal, goodbye, right?
Yeah.
Depending on your relationship. Again, I don't want to put GPs in this bubble. It depends on your GP and the relationship you have with them, right? Like, I'm like you, my GP
100%. 100%. I mean, I work with GPs for a living. And so there are some incredible GPs out there, but they also know this much about this much.
Yes.
Where specialists know this much about this much, right? So they know a whole lot about endocrinology or gastroenterology, where GPs are general practitioners. And so a lot of them, especially more in the older group, especially if it's a male, a lot of them are not well versed in menopause. And so you may get the response like, this is what your body's supposed to be going through. You just have to navigate it. Or you may get,
everyone's like raising their hands.
Or you may automatically just get, okay, let's put you on antidepressants. And you're kind of going, wait a second, I'm not depressed. But the reason that they're suggesting antidepressants is for your vasomotor symptoms, which is your hot flashes and your night sweats. Antidepressants only work specifically for managing those symptoms. And so they are not indicated in the world of pharmaceuticals. We have an indication. Health Canada issues an indication of how we're allowed to use this medication. And so antidepressants are off-label or not indicated for hot flashes, but we are seeing results in that area that are helping women stabilize their intensities of their hot flashes. And so just a little science geeky moment here, but hot flashes are being triggered obviously by your fluctuating hormones.
Yep.
So as our estrogen, excuse me, as our estrogen and progesterone start to fluctuate, I'm going to cough, and I knew this was going to happen.
It's okay. Everybody, I was just saying to, Sarah and I were talking bbefore we came on there. Everyone, my husband's got the sniffles upstairs. She's fighting a cold. It's like
yeah,
fall in Canada. Yeah.
and the more I talk, my mouth gets dry. So the really cool thing about our body is that we start to have reactions, obviously, to our fluctuating hormones, and our hypothalamus in our brain is very sensitive to these adjustments with our hormones. And then it becomes more sensitive to our temperature, because that's our temperature regulator. And so
thermoregulator. That's why I say it's your body, it's a trigger, your hot flashes. Because I went to lunch with a girlfriend and she's like, I looked at her, I'm like, you're hot flashing right now. She's like, oh my gosh. She's like, Moni, why? And I'm like, there's something going on in your life right now that your body just needs to regulate, and it needs to regulate it now. And it creates energy, which creates heat.
Yep.
Right.
And then the cool thing about your body is it's like, oh my gosh, we're overheating. So then what happens is your blood vessels dilate by the skin's surface. And then you get this rush of moisture and perspiration because your body's sweating out the heat. And then you suddenly finish the hot flash, and then you're like, and you just, So there is a scientific method. You're not going crazy. This is all body's regulation of what it's trying to do. Like menopause is kind of like turning the Titanic, right? You're moving in a whole different phase of your life. And there's a lot going on. And we need to honor our bodies and support it in every possible way that we can. And so antidepressants can be an option, and so can HRT. And so if we want to talk about quickly HRT.
Yes, let's talk about the big, because we had one of my clients, and I've heard this before when Jack had an event, someone asked this too, with an expert that was on her panel around the whole study from, I don't even know how many years ago, Sarah, but studied how many years ago, and they're saying no to HRT causes breast cancer. Nope, 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 nope. And now that's totally debunked. So shed the light.
So when I first started in this area from my own journey, I decided I was going to naturally navigate menopause. And that's the name of my Facebook community, Naturally Navigating Menopause. And I decided that's the route I was going to take. And so I didn't really focus on hormone replacement therapy at the time. But obviously, as I've come into this and start working with more and more women, that's obviously a really important component. And so I needed to verse myself on this area, because I'm not anti-HRT. I'm not anti-medication. I'm pro-menopause support, and whatever that is for you. So in 2002, the Women's Health Initiative did a huge study. Women were between the ages of 50 and 79, and they did it over an 8+ year period. And they had over 16,000 women in this trial. And they studied the women's management of hormone replacement therapy. And what they discovered, they actually stopped the trial because the markers were going off for breast cancer, for stroke, and for cardiovascular disease. And so from that, everybody just pumps the brakes, big bad HRT, and nobody wanted to use it anymore. And so it wasn't until probably maybe 3 to 5 years ago,
that pretty recent.
Very recently, there was a lot more review. And in the we do like what we call a meta-analysis. And a meta-analysis is when you take a look at a whole bunch of different clinical trials together, and you take an assumption or an analysis from those clinical trials, and you potentially can create a whole new narrative. And that's what they took a look at the study itself. And the first thing they noticed is, well, look at the cohort of women that are in this trial. They're between 50 and 79. These women all automatically become high risk for breast cancer, heart attack, stroke. We move into that risk factors. And yet when we're looking at women in their late 30s or 40s, or have had a hysterectomy or any of those anomalies that are putting you into menopause early, these are younger women that were not studied. And so they took a step back and said, okay, we can't deny that there are risk factors with hormone replacement therapy. They exist. And they exist more in this cohort of women than they do in the younger cohort of women. And so this is when they decided this is where you have to have a very informed conversation with your doctor based on your own familial risk factors. Do you have breast cancer in your family?
That's a aha moment.
Yeah, you need to take a look at your risk factors.
Your risk
Yeah,
factors in your family and you. Yep.
yeah. And your overall well-being. Do you smoke? Do you drink? Are you
Yes.
active? Are you overweight? And these aren't judgment calls. These are
Yep.
just reality. I mean, as we navigate through menopause, weight management is a realistic concern and a challenge. Our
Mm-hmm.
body starts shifting, our metabolic syndrome starts changing. We start having blood pressure issues, lipids and cholesterol. These are aging things, not that you're doing anything necessarily wrong. And so you have to be realistic. So do you have cardiovascular disease in your family? You know, has your mother or your father or your siblings died of a heart attack young? Those are the factors that you want to have conversations with. And then on the other hand, from the other perspective is, how severe are your vasomotor symptoms? Are you struggling to have a solid night's sleep because you're being woken up drenched in a night sweat?
Yep.
And then even for some women, for myself, I used to be able to know exactly when a hot flash came because I would suddenly have this intense anxiety. I would suddenly come up with like,
Yep.
oh,
And that's what happens. It causes like this, like from I hear from clients, because again, I say to everyone, I told you before we started that I'm 50 and I'm bang on like everything. I have perimenopausal symptoms for sure.
yeah.
But from what I hear, they just feel like it's like this wave. And then all of a sudden you're like, holy shit, holy shit, holy shit, holy shit. Like, where am I? I'm at a board meeting. I'm seeing my grandma at the nursing home or my mom at the nursing home. Like, it just, you have no control. And I think that's the biggest anxiety moment, right?
It is. And I think that's just it. I mean, a lot of women are working full time, and there's nothing worse than when you're having a conversation with a client or with a colleague, and suddenly you're this big pit stain, and you're just, your hair, like some women literally soak, their hair is soaked.
I'm a head sweater. That's totally going to happen to me.
So it's, yeah. And if you're really struggling, then you need support. And I always tell women, you do not, like, once you make a decision, you don't have to stay there. You know, you can start HRT. You're putting into your body what your body is no longer producing naturally by itself. And that's why I work with a lot of women who are on HRT with the intent to come off HRT. So we use it as a bridge. And so let's just not touch anything. Let's get you working on your sleep. Let's improve your stress levels. Let's get your nutrition, because we know what triggers hot flashes: coffee, wine, cigarette, stress, lack of sleep. There are spicy food. There are things that you can automatically assess. Oh, I just did that, and oh my gosh, my hot flashes definitely get worse. And so you can start to do simple adjustments just by recognizing what's triggering them. But then you want to do a deeper dive. And then we move women off of HRT, obviously in conjunction with their GP, because we want to make sure they're taking care. And also even supplemental support. We want to make sure that the supplements that they're using are going to be complementary and supportive with the medication if they're on any. I'm very picky about my supplements, extremely picky. I'm not a big supplement pusher. There are key supplements that I recommend for every woman. And then we work on a protocol, one supplement at a time. Let's hang out here. How is your body responding to this?
It's the same that we do in the 3M. And I think the biggest takeaway here, guys, and what I'm getting to, and it's just a reminder, is that it doesn't have to be HRT only holistic approach. HRT only holistic approach. It can be a blend.
Absolutely.
So you can't just rely, and just with the supplementation piece, you can't just rely on vitamins to bridge your nutritional gaps. It doesn't work like that. I always say that supplementation is your nutritional insurance. It's just piggybacking and boosting what your body may be deficient at that point in time, because it changes all the time. Okay. 100%. So then, so that HRT there, while you're still, and as we say in the 3M all the time, your nutrition's never a light switch. Your sleep is, and we say sleep, water, stress. Those are our big three that we always have to keep a pulse on. It's not like you can do a 10-day challenge and then it's rainbows and unicorns and we're sleeping like amazing, right? Like we always have to keep a pulse. But right away, women, because the diet culture ingrains in us. We go to like, need to eat cleaner. So and so said never to eat grains again. I'm never eating grains. Oh, broccoli is bad for my thyroid. Okay, maybe I should do castor oil packs for my liver, which that's totally fine if you do. I'm
Yeah.
not dogging that. And
Nope.
then, you know, or whatever. So you go, or I should work out more, right? We go to that extreme rather than looking at baseline, like you said. Okay, get curious about your sleep, your water, your stress, nutrition to support it, supplementation with the guidance of someone like Sarah or myself, and then speaking with to your doctor with smart questions and be an advocate. And I think that's the biggest thing that we have to learn is that we have to be an advocate for ourselves and going in and being prepared. And that's why I appreciate your time so much here. I appreciate and have questions ready, right? Like, okay, you know, my family history is this, 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 and this. What do you recommend? Well, I'm still like to learn about this, right? And have an open dialogue with them and come a little bit prepared.
It's beautifully said. I think that summarizes it beautifully. And I think what we also have to, I do get a little irritated when we get told, just do lifestyle modifications, you know, just dress in layers and just go to sleep more and, you know, don't drink that wine. And that's just
or they just tell you lose weight. Just lose the weight.
Oh yeah, just lose weight.
Lose the weight. Like your BMI is high, lose the weight. Right?
And
like it's
not giving you're giving sort of the pamphlet, but you're not walking anyone through it to say, you know, what's resonating with you, what's going to fit in your lifestyle. And you can't just go home and sleep more when you're getting up every hour drenched and you have to change the sheets, you have to change your pajamas. And then when the time you've done that, you're like wide awake. And then the rabbit hole starts and you go down that. And then you wake up the next morning dragging yourself out of bed. So now you're physically and emotionally exhausted, and that triggers stress and your cortisol levels spike. Then you're fatiguing your adrenals, which then puts you into a whole other level.
Your fat storage hormones are triggered and your liver's overtaxed and like everything cascades.
Right? Cravings kick in and you're just, So you really, it's really a very methodical process. I call it peeling the onion. You know, you just have to take and I work with my clients one layer at a time, and let's just work one thing at a moment. And that's why the coaching part of working with a nutritionist or any kind of health counselor is the most vital part, because that's the attention that you need specific to your needs, that customization, because then you can really be felt like you're heard and felt like you're really working with them independently as to say, you know, this is what I would like you to do next. And then we get together and go, how did that work? But I think most importantly, more than anything, is the first thing everyone has to do is put yourself at the top of your list. You should always be at the top of your to-do list and always prioritize where you are and what you need to do. And if you're feeling overwhelmed, that's when you can reach out to someone like Moni or myself, where you can say, you know, please help me navigate through this. And I love the collaborative approach, right? We need to have as many people around you. You need a supportive team.
Your health, that's why I said your wellness team is not just one. And we have it. You have it. I have it. And it's not that you always are seeing them all the time. It's whatever season, we call it seasons of life here in the 3M, whatever season of life you're in, they were like, okay, I need to pull on that my support. I need to pull on that my support. But it's that daily checking in with yourself. Daily. What do I need? What's going on with me? How much energy? We say in the 3M, everything's an energy exchange. When the energy of those days, it's out, 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 out. We need to bring them back, bring energy back in. And will that affect your menopausal symptoms and what you're going through? 100%.
Oh yeah. And there is 100%. One other thing I wanted to mention regarding HRT, just to give a little bit more guidelines perspective. If you have made that decision, keep in mind that if you are, the recommendation is to start HRTs earlier as possible. If you choose to do HRT, they suggest you start early as possible, because once you sort of within that 10 years of postmenopause, at the age of 60, that's when you do an annual assessment as to whether you should stay on it. And so you're kind of able to keep on it with, and they'll monitor you. Keep in mind that it is a bit, you're going to have to adjust the dose. You may see improvements with one symptom, but not with another. And that's why that collaborative.
Oh, that's another tidbit, because I think everyone's like, I started HRT, but I'm still moody. Night sweats are gone, but I'm still moody.
Yeah. And it's not like it's not like, I mean, because I'm in the diabetes field, it's very easy. You inject insulin to manage high glucose. That's its job, and it does that job. HRT is very different. You're putting something in that like exogenously that's not being produced anymore. And that's, you're going to find that happy medium between and they're constantly fluctuating. So you're kind of chasing that stabilization. And so you get side effects that you didn't have before, where one thing may fix, but then you have something else happen. And same with antidepressants. So when you're working with any kind of pharmacological molecule or anything like that, your body's going to respond, and everyone's going to respond differently. So keep in mind, it may not fix everything, and that's why you want to be able to do something else as well. But the guidelines say that you are good to start HRT, but at 60, it's an annual assessment. Has anything changed? Is anything going on with your body that's different? And you may have to be pulled off. And if you're worried about cardiovascular disease, if you're worried about osteoporosis, if you're worried about breast cancer, those are the things that if that is more of it's a risk versus benefit, right? You have to weigh it yourself. From an osteoporosis perspective, start doing weight-bearing exercises. Cardiovascular, just walk,
move your body.
You don't have to do HIIT. In fact, I discourage HIIT for a lot of women that are in really intensive menopausal symptoms. It's just going to stress your body. But
and it's just a sidebar for guys. It's the same as when we talk about your stress loop and your stress cycle for those that are in that fatigued burnout. How we talk about HIIT is the last thing you should be doing. We need to bring you back up. We need to bring cortisol back up a little bit to regulate. Okay, so it's on the same line as what we're talking about here.
For me, moving your body is about physical health. Nutrition is about weight health. And so you can like super, super great. But you can be skinny weak or skinny unhealthy, right? But if you're moving your body, but you're still eating excessively, you're never going to get your weight in management. So the whole idea of exercising is to strengthen your body, because you want to be able to sit on the toilet when you're 75.
Yeah, we call it it's because I'm a functional nutritionist. So we say that the losing the weight from working out is a subset. Like working out is about stress accommodation. If you're at that level of your stress loop, right, and your cortisol levels are on point, it is about self connection. It is about like osteoporosis and cardiovascular health and being able to carry the groceries up the stairs when you're 80. And the subset of that is because you're developing the lean muscle mass to be metabolically more reactive. You're utilizing fats and carbohydrates better. But if your nutrition is not supporting it and on point, right, it battles.
Exactly.
It battles. Anyways, we could talk forever and ever and ever. And I think I saw some questions pop up, but guys, I think we covered anything. For those of you that are watching the replay, if anything comes up, just put your questions below and let me know. And then I'll go back to Sarah and she can come in and answer or give me the answer, and I'll post it for you. Is there anything that you want to close with before you share where everyone can find you and what resources you have?
No, I think we've really covered it. I really love the comment about, we can do both. It's not either or. And just make sure you advocate for yourself. Do not be dismissed. And if you don't feel like that is something that just make sure you get the answers that you deserve. You don't need to suffer through menopause. This is not a time for you to be suffering. There are solutions, 100% solutions, whether you do it naturally. I'm in postmenopausal now for 5 years, and I manage all my symptoms, and I have all the way through naturally. I still am not on any medication. And so I was forced that. And so I don't want anyone else to be in that position. And that's why the more you know, the more you can make that educated decision, and the more you advocate for yourself. But please prioritize yourselves. You've earned it. You're at this stage of your life now where you deserve to be number one.
Yeah. And give yourself some grace. It's not going to happen overnight. And that's the frustrating part about it. I think it's just like when you said 8 to 10 years, I bet everyone's like, oh my God. Right? Like
it doesn't have to be suffering the whole.
It's the onion. Yeah, it's the onion. It's the onion. I love that analogy. It's just step by step, piece by piece, right? It's just like the fat loss that we talk about in our group, right? It's not going to be like that. It's the onion.
And you do
sorry, go ahead.
Results. Like even though it's slow, you do see results, right? Like it's not like you got to wait a year and then, oh, finally I see improvement. They're baby steps.
Baby steps. I love that. All right. So where can everyone find you? And if you have resources to share.
So probably the best and easiest, has all my stuff, is Menopause Balance. So www.menopausebalance.ca. That has all my programs. I have programs that are super tiny, that are like a couple of weeks, that are self-driven. Like you go in there and you just go through the modules. I have a 6-week program that if you just kind of want to get started and get into like, how do I even begin this journey? And then I have my intensive 3-month program as well. And that's all on my website. I'm on Instagram, Menopause Balance, and Facebook. If you're interested, is Naturally Navigating Menopause, if you have any questions. But always feel free to just DM me off of my Instagram. And I'm a little quiet on social media right now. I've had a lot going on. My daughter just took me to the UK.
Excuse me. Yeah.
Oh, yeah.
I was like, we're all sick, sneezing. Yeah. I got my cat here. It's making me sneeze.
I was saying to Moni, I was like getting ready to put my mask on. And then I'm like, nobody's going to hear you. So it's been a very, very busy fall, but I'm going to be, I'll be hitting the ground running again in the next month and just get back in there. We've been very busy. So but I love to hear from anyone, even just if you have any questions. I'm very open to answering any questions, making sure that if you're interested in working with me, we want to make sure it's a good fit for you.
Yeah, I love that. I love that. Well, my friend, I really appreciate your time. This was fabulous. There's so many nuggets. And I always learn something when I do these expert interviews. There's always something that I take away too. So it's been beyond a pleasure. And any questions, guys, like I said, just let us know. I'm getting a lot of thumbs up and thank you. So that's great. Yay. And have an amazing, amazing Friday.
You too, everyone. Enjoy your weekend. Bye now.
Guys.
Thanks.